Good morning. Hello.
Good morning.
Okay, good.
How are you this morning?
I'm doing well. How are you all?
We're doing well. Thank you so much for joining us. We truly appreciate it.
Sure, my pleasure.
So, County Executive, just briefly, I know you're familiar with MCA. Um, our members are, the contractors in the community that really make a difference. We really are, building the schools, building the universities, building the high schools that you're so familiar with, and so our contractors can be are anywhere from multinationals to middle market, and then literally mom and pop shops, small businesses. So it's a real honor to have you this morning in these crazy days we're living.
It's absolutely my pleasure. Chuck, would you like me to just go ahead and hop in here, or?
Yeah, I just really, just so everybody knows, everyone's familiar with you. You're obviously well known in the community, but just so everyone knows, the county executive served 2 terms in the General Assembly, served in the Ways and Means Committee, Economic Matters Committee. He taught for several years in the Baltimore County school system, and even taught at Goucher College. His bio is incredibly lengthy. I could speak for 5 minutes with it, but
Please don't.
So he's now the county executive of the 3rd largest jurisdiction in the state, with a population of 830,000. That's about 250,000 more than Baltimore City. He manages a budget of about $4 billion. That's basically equivalent to the state of Delaware's budget, and he's a real friend to the contractor community. So thanks so much again for joining us.
It is my absolute pleasure. So thanks, Chuck and Melissa, for the invitation today. I'm really honored to be here. I want to thank all of your members who are on today for all that you guys are doing in the community to literally, help us build things from the ground up and, build our community up. I don't have a lot of detail on the budget today, but I guess I wanted to just say, I think because it's relevant, we are trying, even though we are facing a nearly $200 million write-down, to both keep our funding in the capital budget, because we know that this is probably now more than ever an important time to keep people working in construction, and infrastructure are some of the most important things we can be investing in when the economy is being challenged. And then I was extremely disappointed to learn that the Build to Learn Act, which would have pumped over $2 billion of school construction across the state, including nearly $500 million from the state, which would have been matched locally, for almost $1 billion of school construction funds into Baltimore County, was vetoed as a result of the other legislation being vetoed at the state. So we're going to try to get that back on track, but it's unfortunate that we've got over $250 million of money set aside locally in shovel-ready projects that would have been matched. So we would have put this year probably about $500 million into production on construction. So I'm committed to it. I applaud all of you for the work that you do, and hope that we have more chances to keep people working. So we'll start with that. But it really is a pleasure to be here. And before I get into the other prepared remarks, in addition to the budget detour, just please remind everyone that the social distancing stuff remains one of the best things we can do. Keep taking appropriate steps to take care of yourselves, your employees, your members. I know that all of this isn't easy for anyone. I am a huge extrovert, and I draw my energy from other people and being around them. And so I am not built to stare at computer screens all day. But I've been doing it for quite some time, and I know this is hard for all of us. I also acknowledge, as I said at the top, that this isn't good for the economy, which I know everyone on this call knows. So we are going to try to make sure that we keep doing all that we can to keep things in production. We're trying to help small businesses. We have a $10 million small business grant out there. So if any of you think you might be eligible, feel free to follow up with me and my team. We have had application for about half of that money already in about a week, but we want to make sure we're trying to help those who haven't, especially those who haven't been able to access things like PPP and EIDL, hopefully try to get through to the other side of this thing. So I thought today we'd just give an update on the response to COVID and where we are, and then take some questions at the end. So to just sort of give, if this thing wants to work, just an overview of where we've been and where we started. It's hard to believe that it's been a couple of months now since we've gotten our first case of COVID-19 in Baltimore County back on March 11th. We immediately stood up a county hotline that has now taken thousands of phone calls. We quickly moved to suspend all senior activities, libraries, rec programs. We've moved to a pretty robust telecommunication working plan for our employees. Of our non-public safety employees, so non-police, non-fire, non-EMS, we have almost 75% of our workforce is now working remotely in Baltimore County, trying to keep them safe. County buildings have been closed to the public, although we have continued via telework and a very limited crew in our buildings. We have managed to keep things moving. So we are still processing permits. We are still doing inspections. We are still out there in the community. And so we've had to adopt our strategies, but we very much want to keep work moving. And so we're still doing all those things to keep things going. We also had to stand up our EOC after we initiated the local state of emergency. So our Emergency Operations Center was stood up on March 16th. It's been a new experience. Typically that facility or that center is used for major storm events or floods, and it's a couple of days and people will, pack up their overnight gear and spend a couple of days. But we've had to change things as how it operates. It's now been open for more than 2 months straight. It's now entirely virtual, which are all, very much first for Baltimore County. So, but if you're more interested in some of the granular details, there's a website. It's just baltimorecounty.md.gov/news/coronavirus if folks wanted to have more detail on some of that. But we're doing all the things we have to do to keep people safe, providing extensions of licenses and permits, suspending evictions, stopping water shutoffs. In partnership with the school system, we've now distributed almost 1.5 million meals at no cost. We have a nonprofit emergency response fund that is giving organizations who are filling the gap. And as I mentioned, we're doing the $10 million in grants. Just a sense of where we are. This data is actually already dated. Obviously, it's evolving. It used to be a week-by-week approach to governing, and then we've gone from day to day to almost now hour by hour. But we've consistently had, as the third largest jurisdiction, the third largest number of cases in Maryland. We're approaching 5,000 positive cases, and unfortunately, we're approaching 250 of our residents have succumbed to this virus. And we publish this information every day on a dashboard that we have in Baltimore County by zip code. We have demographic details by it. What I will tell you is that we are unfortunately seeing a large number of our cases on the death side are being tied to the nursing home and long-term care facilities. We just announced yesterday that we're going to be doing, even though they're state regulated, we're going to be doing additional PPE for those facilities to help fill some gaps. But, if you pay any attention to Baltimore County government, you know that I'm a data-driven leader, and so it's really important that we use that. The data is being both pushed externally and then additional information is being managed internally by our county stat team, which has been converted to a COVID stat team. But really, we want to make sure we're getting that information out there. And again, the biggest area of concern currently remains the nursing homes and long-term care facilities. We know that that's one of the places where we're not going to be able to move to open those up. I don't think anytime soon, even as we think about some sort of phased reopening of our society. So our numbers continue to increase, but we are certainly getting there, and we're trying to do all we can to meet the full reopening as phased out by the governor. We know that we have a couple of hurdles that really stand in our way to really safely reopen and stay open. These are consistent across the country and the world. Testing availability is a huge challenge, contact tracing, as well as access to PPE. So I think the best thing I can do here is to just level set a little bit about, before getting into the details of these three items. Dr. Lena Wen, the former health officer of Baltimore County, wrote a really great op-ed in the Washington Post last week, observing that, we've made the decision to reopen in the state and the country, which isn't actually the best public health decision, but obviously balanced against the economy, that's where we've decided to go. So the question becomes, how do we do that in a way that mitigates the spread of the virus? We're not at a place where we're mitigating it we're stopping it. We're just trying to do sort of what you call harm reduction at this point. So I think Governor Hogan took a calculated risk when he decided to move to phase one. We have taken a partial approach, adopting most but not all of those practices. And so I think what we have to do is just be honest about that and do what we can do to minimize potential downsides associated with the risks there. So we know that we need more testing available to get closer to a testing on demand model. Just for example, the 500,000 test kits that the state received with great fanfare from South Korea have not made their way into circulation. We have asked for weeks for a timeline for when we might see them, and that still has not been provided. So we are currently exploring all of our options locally to get more tests, including partnering with other local governments, as well as we're in pretty robust conversations with some private companies. The state currently also requires patients to have appointments through a system called CRISP, basically like getting a prescription from a doctor. We're asking the state to allow us to open up some of those restrictions because we currently have test capacity and appointments that aren't being filled because of the requirements being set forward by the state health department. In addition, we know that we need more contact tracers, people who investigate those who were sick to help keep those who were exposed to quarantine and isolated. In some countries, it's all technology. I think Americans have, rightfully so, some concerns about the government tracking them with technology. So we're also supplementing existing technology with human contact tracers who make phone calls. We're partnering with the state to try to make sure that we get that partnership moving, but we need to get their operations set up so that we can supplement what they're doing. Obviously, PPE is sort of a moving target. Changes move week to week, and the supply chain is moving week to week alongside it. But again, I mentioned earlier, we're doing what we can to make sure we're meeting the gap in places like nursing homes. We are doing a good job at this point, I think, of taking care of our first responders and frontline workers, but we know that we need to have a steady supply chain for our health workers, hospital workers, and some of our frontline workers to keep up as we open and move towards that. So the current executive order under the state, the governor shifted from what had always been a statewide approach and what he had said was the better approach to what now he's calling a more flexible community-based approach. What that means is you're seeing the jurisdiction by jurisdiction approach. And so a lot of that, frankly, is there was a plan the governor published, and he opted for whatever reason not to completely follow it. And so we are left locally on our own to stand up a full reopening process and put the positions and the people and the processes in place that were in place at the state that are now being forced to be replicated in Baltimore County. But I think just one example of that is that the governor's plan for indoor church services was supposed to begin in his phase 2 part of the plan, but now he's decided to allow them happening in phase 1. But in Baltimore County, what it looks like as things stand today, all personal services except barbershops and hair salons were already remain closed under the state. We did choose, again, for the time being, to have barbershops remain closed, but we are working on guidance so that we can potentially open those up safely. Retail stores are allowed to open for curbside, but we're not quite ready for in-person retail yet. Again, working on guidance to find ways they can operate safely. Indoor religious services, one of the most at-risk, one of the most risky activities that health experts know are still prohibited. In fact, there were some CDC findings about outbreaks related to indoor church services that were pretty chilling, but we do allow churches to continue with drive-in style services. And I'll just say, as a person of faith, I miss my church. I am doing the live streams. It is what I need to do now to keep safe, but I miss church as much as the next person, but I think we're trying to do the right thing. Otherwise, we're pretty much in line with the governor's existing orders, prohibitions of gatherings, but manufacturing open, and otherwise we're in line. So make sure I'm not missing anything else here. So, I'll just say before I move on from this slide, we are really doing the best we can to balance our public health leaders against what we want to do and what our economic leaders are asking for. So it's a challenge, but we are trying to be safe and cautiously open up as much as we can. There is a balance in all of this work, and we were one of the jurisdictions that did a partial opening. A few of the other major jurisdictions, Montgomery, Prince George's, and Baltimore City, all decided to do an outright stay-at-home continuation, which we just did the guidance along with the governor. They did not move to open anything. We partially did. So we're doing our best to balance public health leaders against what people want to do and what the economy we think needs without leading to more spread. So it's a fine line, but we're walking it. But in the meantime, we know that we are not out of the woods yet. We have seen at best a plateauing. We have not seen declines. We still don't want to have our systems overrun, and we want to make sure that we have, again, those our health systems overrun, and we want to have the other health systems in place, the testing, the PPE, and the contact tracing, so that we can stay on top of cases as they potentially grow. So we want to work with employers to make sure that they keep themselves and their employees safe. But we're asking folks to keep staying home when they can, especially our most vulnerable. Keep having employees work from home where possible. Residents should wear masks in public, socially distance, and really this is about how do we stay thoughtful to what is a rapidly evolving situation, follow the data to reevaluate. And again, we're reevaluating what seems like hour by hour as opposed to week by week or even day by day. So at the end of the day, we're here to be a partner and a resource. So feel free to reach out to us with any questions. And with that, I'm happy to also answer any questions you all may have this morning.
Thank you, County Executive. It's very helpful. Really, we all really appreciate the guidance. These are crazy days. And the first thing it didn't occur to me that because you hear so much fanfare about Prince George's County and Montgomery County, I'm aware that they had the third most COVID cases. So I'm not sure how that's not more clear in the media, but thank you for making that point. I think that certainly supports your recent decision. Also, kudos to the news, I guess in the last 12 hours about the tests and the masks and the gowns that were obtained for the nursing homes. So that's just really, really an incredible act. So well done on that.
Thank you. Yeah, I mean, I think that's the balance. Is we know that we are, and we're not per capita, we're not nearly as the DC suburbs are absolutely a hot spot, and so I understand why some of my colleagues, particularly in Montgomery and Prince George's, decided to stick with an outright stay-at-home order as opposed to a recommendation. I understand why they chose not to move towards reopening on any of the things that were allowed by the state. But what I can say is, unfortunately, this has really caused a lot of confusion. But we're trying to balance the fact that we feel like we've got we're moving towards a lot of the infrastructure we need with surge capacity, PPE, testing and contact tracing, but again, recognizing that we're the third highest, and that there's a potential for a large spike. So we want people to work, we want people to be out there, but we also don't want to have to go backwards and shut things down, or have people get sick or die unnecessarily. So I appreciate all that.
So we're going to just, we know you're incredibly busy, but we did want to open it up for at least a couple of questions from our community. What we have, and you're in the middle of a war right now, so it's probably hard to think long term. But you are a data-driven leader, as you indicated. Any early indications of what impact this might have on the budget? I mean, you're hearing justifications for some of the governor's actions. He leaned very heavily on COVID-19, but have you ever had a chance to look at that closely? What impact that's going to have directly on the county budget?
Yeah, I mean, we have when I submitted my first budget about a little over a month ago to the council that they are trying to review and finalize, I had already written down $40 million of additional spend. And I'd say about half of that came from operational reductions, and about half of that was less capital spending that I would have liked to otherwise do. Since then, we've written down the budget again, and we've found that we expect about a $60 million shortfall in the existing fiscal year budget. And so we are working to make mid-year cuts to account for that. And then we're also working with the council to find another $60 or $70 million of reductions for the upcoming fiscal year. So, all told, you're talking about $120 million since budget introduction, another $40 million from when it was initially submitted. So we are going to be having about $160 million less than we originally would have under, pre-COVID conditions to spend. So it's a pretty significant impact. We are, and again, that's our best guess at this point on where we are. It's hard to say when and how and what recovery looks like, how slow or fast it will be, what the economic activity will be. But there have been, big implications. We see the state already planning to make their cuts. The numbers we've sort of accounted for so far in our budget planning do not speak to whether or not the state hands down their cuts to us. I mean, I don't think we can really bear much more at this point, but in past economic crises, the state has also cut aid to local governments, for example, which would in turn force us to cut even further. So we're I think it's fair to say that we are equally concerned from a budget perspective as to what the coronavirus will be doing to our finances. But we've budgeted smartly over the years, and we're one of a few jurisdictions that has that AAA bond rating. So I think that's a mark of how we've made the decisions we've had to do. We have over a 10% fund balance, rainy day fund. So I sort of joke that I don't know that there's a much rainier day than a global health pandemic. We've been able to avoid touching that to date, but we've done things like a hiring freeze. We've slowed non-essential spending. We've stopped all out-of-state travel. And in addition to all that, we still have a full rainy day fund. So we're working our way through. I think so far we're okay. We're in a good spot. The council votes on the final budget, I believe, next week or the week after. But it's been a partnership trying to make sure we provide those essential services and focus on the basics of education, public safety, and our employees, who are really our most valuable resource.
Thank you for that. We have another question from one of our members. When will you be hiring more contact tracers? My spouse completed contact tracer certification 2 weeks ago and is really looking forward to any direction. Any thoughts on that?
Sure. Well, I hope that whomever's spouse took it was the CCBC training that we stood up a few weeks ago, knowing that this was going to become a need. We're about to hire, I think we just had an application process for the county close on Friday. We are set to hire about an additional 70 people, and we want to have them on board by July, because we know as the testing ramps up, we're going to need these contact tracers. We actually are reviewing those applications this week. I believe we had over 400, somewhere between 400 and 500 people apply, which is great. We're going to be reviewing those applications this week, and we hope to be scheduling interviews, if not late this week, certainly early next week. So we really are moving quickly. We're expediting this hiring process because it's so critical to have those folks on board. And again, that's one other place where, since we're moving so quickly, that will help us sort of stay on top of the mitigation strategies that are required, as part of a thoughtful reopening.
Thank you. Another question, County Executive, is that's a good question. What do you anticipate seeing regarding the November elections? Will the polls be open, or do you think people be expected to vote via mail?
This is just based off of a recent announcement. So the governor recently, with the Stronach Group, announced that the Preakness is going to be in October. So I believe that if the state is saying that we can have that many people at an October event, I mean, barring a huge spike in cases again and return to some sort of shutdown, I believe that the November elections could be back towards a in-person activity. I do expect that there will probably be an encouragement to vote by mail or absentee. The numbers of people doing that will probably be higher. But I don't know how we can say it's okay for thousands of people to gather at a sporting event and not allow people to gather or vote in person. So that's my guess as of 8 o'clock in the morning on May 19th, but that's my best guess at this point. Certainly subject to change. Again, these things are changing so quickly, it's hard to keep track of the next hour, let alone November, but that's a really good question.
Did you just make news by announcing that the Ravens are going to have 70,000 people in their stadium in September? Is that?
What's that?
Did you just make news that the Ravens are going to be playing with 70,000 fans in September? Is that how you heard it?
No, I'm only basing it off of the governor's announcement about Preakness. So, but I will tell this group, I'll give you a little bit of inside information. We are actively working with the Ravens organization to, when the state allows it, and when the NFL decides to, at least allow them to start doing some of their internal training work with staff and to prepare for. So we're not at a point where we're talking about players, but we are talking about how we can at least get some basic staff into the Owings Mills facility to prepare for what might eventually be a season.
Excellent, thank you. It looks, I'll give one more opportunity to ask a question. Melissa and I are here watching the queue. Maybe give it 10 more seconds. I think that's all we have for you.
Okay.
Yeah, we really appreciate this. It's been insightful, and we know you're incredibly busy, so it means a lot that you gave us your time this morning. And really, I'm sure it's an impossible job you're dealing with right now, but we really appreciate you being such a great public servant.
Well, I appreciate that. Thank you again for having me. Thank you for all you all are doing. If we really do want to be a partner in this, so if there are questions or needs, please don't hesitate to reach out to us. I've been lucky that I have an awesome team in Baltimore County. So I hope that if there's a need or an opportunity to partner, you all have a chance to experience the great team that we do have. So stay safe, and thanks again for the opportunity to join you this morning.
Thank you so much. Have a great day.
Thank you.
Thanks. Bye-bye.